in our state and our community. We wanted to offer a few experts who can comment on what we're seeing here at UAB, in our county, and in the state. First, we will have Dr. Jeanne Marrazzo. She's the Division Director of UAB's Division of Infectious Diseases speak. Then Dr. Sarah Nafziger, who's the Co-Director of UAB's Hospital Emergency Management Committee, will be speaking. And then following up will be Dr. Mark Wilson, the Jefferson County Health Officer. Before we begin, we wanted to share with you all that today UAB is caring for 68 COVID-positive patients. This is our highest number of inpatients since last Saturday, which was at 64, and then April 4th when we were at 63 patients. So these numbers have been steadily increasing, and the experts today can give a little bit of background as to why that may be. We'll welcome Dr. Marrazzo now.
Great. Thanks, Savannah. Hi, everybody. So a couple of points about what we're seeing in the state in particular. It's been an unfortunate series of days of record setting. Yesterday was the first day that we had over 1,000 cases reported in a single day. In fact, we had 1,014. And if you average the new cases per day over the last week or so, it's about 724 cases a day. So there is no question we're seeing more. Our total is now almost 26,000 cases that have been reported, and almost 770 people have lost their lives due to COVID-19. A couple of other points about this. We've tested about 300,000 people in the state, so that is a pretty small percentage. So clearly we are testing people who need to be tested. If you look at where these infections are occurring, they are increasingly widespread. So one thing that's changed from the early days of this epidemic is that most counties are now reporting cases on a daily basis. So the pandemic, the epidemic locally has really managed to perfuse into really every part of the state. We certainly have been seeing a concentration in urban areas, and we've seen that since day one. Part of that was almost certainly because that's where we were testing and where we had testing available from day one. But we're now very clearly seeing, given the reporting of cases in these counties and also looking at where the hospitalized cases are coming from, that they're being drawn very heavily from some of the more rural areas of the state. And that, as I have been emphasizing since day one, is a huge concern, given that the people who are in the rural areas have a much higher prevalence of some of the more alarming risk factors for mortality and bad outcomes related to COVID-19. So that's not a very good sign. People often ask about whether these increases in cases are just a function of increased diagnostic testing, and that is a great question. I think there are several ways that you can look at the data to try to figure that out. One of the things that we look at are the percent positive over last 7 to 14 days. And if you look at our percent positive overall, on average, it's been about 8%. So about 8% of the tests that we have done in the state of Alabama have been positive. That you can compare to a place like Seattle, for example, where they're really on the downside of their epidemic. Their positive rate is down to about 1.5%, so an enviable place, which we are not at yet. If you look at the positivity, and that's a positivity, again, over a long period of time. If you look at the positivity in the last 14 days, it's about 8%. But if you move that up a little bit and just look at the last 7 days, the positivity is now close to 13%. So that's telling you that, yes, you may be testing more, but you're also detecting more. So it's a real, I think, a real increase in cases that we're finding. The other thing you want to look at, of course, are the hospitalizations that are occurring as a consequence of this disease. And unfortunately, as Savannah just noted, our census numbers are not coming down. In fact, people ask about a second wave here, and I've been saying we never stopped having a first wave. We have been really pretty much at steady state since this thing started. Our census at UAB has been essentially between 40 and 65, more commonly in the 50s, but as was noted today, we're now up again in the 60s. Other hospitals in the state, as I know you're aware, particularly in Montgomery, are really facing challenges providing intensive care for ventilated patients. Probably saw some press on that today. And the third part of that is that our healthcare workers are really getting stressed. I mean, it's a really intensive amount of work, as you have heard many times, to take care of these patients in the ICUs in particular. The other challenge we're facing, again on a medical update note, is that we now only have one emergently approved antiviral to treat this infection with. You may have seen today that the FDA removed its emergency authorization approval for hydroxychloroquine and azithromycin, given concerns about the lack of efficacy and also safety signals with those drugs. So now all we have is remdesivir, which we are studying in clinical trials, but is not really in good supply for the state. There's an emergency authorization use, but we don't have enough remdesivir to treat everybody who's in the hospital. So it's a really challenging situation, and I would just again emphasize that the timing of this is pretty perfect for when things started to open up at the end of May, right? We're on June 15th. That's exactly 15 days after the end of May and a little bit more after Memorial Day weekend. So if you do think that there is that relationship of 14 to 18 days, which is really what we've been saying is important to look at the trends, we really are probably in the thick of it. I think it's more related to people just stopping the really great attention they had paid to wearing masks and to social distancing, with a lot of not opportunities to go out in those early days. And people are now going out. Unfortunately, a lot of people are going out and forgetting that wearing a mask is an essential part of being able to re-enter society. So I would really plead with you, once again, if you're going to go out, please wear a mask. If you don't do it for yourself, do it for the healthcare workers who are really getting wiped out by the persistence of this process and the increasing numbers of people who are really, really sick, particularly in the Black Belt and in the Montgomery area. So remember, good hand hygiene, social distancing, physical distancing, and mask wearing. Those are really the key things to do. I'll stop there.
Great, thanks. We're going to bring Dr. Nafziger up, and then we'll hold questions till the end.
Well, thank you very much. My name is Sarah Nafziger. I'm a physician at UAB Hospital, and I would like to just make a few remarks today. Our number of COVID-19 patients at UAB Hospital has been gradually increasing, as Dr. Marrazzo just mentioned, and we're seeing a trend in increasing numbers of patients across the state. This is all happening in the setting of UAB Hospital really starting to increase the number of inpatient procedures that we perform. We are about at our pre-COVID levels of inpatient procedures that we're doing on a daily basis, and our outpatient procedural volume is close to where it was before COVID started. So what that means is that us as entity, a hospital in the central part of Alabama, in our region, and our state, we really are going to need to take an action to stop this increase in COVID-19 cases. So how do we do that? The message is simple. It's the same one that we bring over and over. We got to wash our hands often, avoid touching your eyes and face, don't touch your nose and mouth. Wear a mask when you go into indoor public settings. If you're going in a place of worship, a grocery store, a restaurant, indoor businesses, wear those masks. And of course, continue your social distancing efforts. We want to stay 6 feet apart where we can. So vitally important. Now, I know we are weary from that message. It's getting old for sure. It's old for us to keep repeating it, but you know what? This is our new reality now, And doing these things can help slow the spread, and more importantly, it can help us open back up our economy in a responsible and safe manner so that we can kind of get our lives a little closer to back to normal. The consequences of not slowing the spread of this virus will impact patient care in a lot of different ways. If it continues to accelerate, we at UAB and other hospitals in the state will have to devote more of our resources to expanding our COVID critical care units and our acute care units, so that that would negatively impact our ability to provide other services that patients need that we so desperately want to provide. We would be forced to once again postpone elective procedures, and a lot of these things are really important healthcare needs that people need to have done. Just because a surgery or procedure is elective, that doesn't mean that it's not important to the person. Just because it's not an emergency doesn't mean that it's not vitally important to your health care. So we want to be able to stay open to providing all those services. Now, let me be clear, at UAB Hospital right now, we have capacity to take care of you. We are able to handle the volumes that we have right now, both of regular routine patient care that we do normally every day, day in and day out, and then also to take care of COVID-19 patients. But as these numbers creep up of COVID-19 patients, we do have some concern that maintaining that capability to provide routine services will become much more difficult. So I want to take a moment to talk about visitor restrictions in hospitals. This is something that has been particularly difficult for us in the hospital during this crisis, as we've needed to curtail the number of visitors who come to the hospital to be with their loved ones. We've really transitioned from thinking about a visitor at the bedside and really thinking about your loved one as a caregiver at the bedside. After the governor's Safer at Home order on March 20th, we really had to take a stand to prohibit visitors to the hospital except for in certain compassionate care situations, such as when you're having a baby or end-of-life care or support for people who have special needs. So in those situations, definitely we are allowing caregivers at the bedside. In most instances, only one caregiver is allowed per 24-hour period. Please understand that UAB Hospital and every other hospital in the state, we're trying to do everything we can to accommodate the patient's needs, but we're balancing the safety of our patients, of our healthcare workers, and of our visitors against that desire to have visitors at the bedside. So we're going to have to ask that you help us and do your part in helping us limit the spread of this virus. So I want to take a minute to talk about our relationship and partnership with other hospitals in the state. I know this is a UAB press briefing, but I just want to take a minute to commend the other hospitals in the state. We've been in contact with leaders from other hospitals, both in our region and across the state, and let me tell you, Alabama should be very proud. Every hospital in the state, without fail, is doing their best to take care of these patients, both routine business and patients who have COVID-19. And let me tell you, they're doing a phenomenal job of caring for these patients and really stepping up to the plate and providing care for these folks. In general, UAB has not received an extraordinary number of transfers from other hospitals for COVID. We do have, transfers that come to UAB for other conditions, the things that we normally take care of that are more tertiary care needs. We still have those patients transferring to us, but the number of COVID transfers has not been significant. Only 14% of the COVID-19 patients that we've cared for so far at UAB have been transfers, and almost all of them have been sent to UAB for specialized intensive care therapies that could really only be provided here. So it's not been a huge component of our COVID care. Lastly, I'd like to thank all the healthcare workers in Alabama, especially the ones that here at UAB, for all the work that you're doing. I'm going to be honest, this has been a very stressful event for our staff. It's been going on for several months now. And whether you're a bedside care provider, like a doctor or a nurse, or whether you work in a supporting role, like our environmental services workers, our food nutrition workers, all the, lab techs, I could go on for days to name the roles, but we're all a little bit weary. Just like people are tired of wearing a mask in public and they're tired of social distancing, you know what, we're tired of COVID also, and we really wish it would just go away. But while we're still tired, we're still going to be here to do our job, and we're going to continue to do it. We're committed to our patients. We're committed to each other, and that's not going to stop. We're going to be here to take care of our patients, and nothing's going to change that, not even a virus. That concludes my comments. Thank you.
And we'll welcome, when Dr. Nafziger is finished, we're going to welcome Dr. Mark Wilson up, and he will give some remarks, and then we'll do questions from him, and then back through Dr. Nafziger and Marrazzo.
Good afternoon. I want to thank UAB for allowing me to join them today. Just a few comments about Jefferson County. Jefferson County has done relatively well so far in some ways. Certainly we've had high numbers overall, but lower numbers per capita than we might have expected for being a largely urban area and an intersection of a lot of interstate traffic and such. But I've been very concerned about the increased numbers we've seen not only across the state but in Jefferson County. People, again, often ask, is it not because we're doing more testing? We are doing more testing, that's true, but when you look at the percent positive, we've had a baseline positivity rate of around 4 to 5%. That's of those tested, about 4 to 5% of them have been positive in the last few weeks. This last 3 days, if you look at those numbers, it's been over 10% in Jefferson County. And that's the first time we've seen it go up that high. So that's quite concerning. And we are concerned that several days from now could translate into more hospitalizations and, heaven forbid, more deaths. I do want to make one comment about a headline that was in the news several days ago that some people may have noticed, a statement made by a physician at the World Health Organization that implied that there was no such thing as asymptomatic spread, or that was very rare. That was since walked back, and we just want to make it really clear to everyone that just because you don't have symptoms today doesn't mean that you're not already infected, or that you can still spread the virus. We know that to be true, in particular those that are pre-symptomatic, people that are infected, infectious, but not yet exhibiting symptoms. So what that means, it's been the same thing we've been saying all along, is that everyone needs to assume that they could have contracted the virus and that they could be spreading it even if they don't have symptoms. And that's why we're asking everyone to take these precautions. So one of the most effective things that can be done is the face coverings. Anytime anyone's in a public area where they're likely to come in close contact with other people, even for a brief moment, we want those face coverings on, and we really, really need your help with that. We thank all those that are doing that, but we really need it to be more consistent in our community. And just a reminder also, the face coverings are to protect other people. So if you're young and you're healthy and you get COVID-19, you can still get sick and you can be very miserable, but the chances are you'll survive it. The chances are very good. But I want everybody to think about who else you might spread the disease to if you're not wearing a face covering in public. Think about who you're going home to, who's in your own home that might be more vulnerable, a parent, a grandparent, somebody with an underlying condition. You might not yet have symptoms and you might be bringing it home, or you might be causing one of your friends to get it and then bring it home. We know that a lot of spread is occurring in homes. So please think not just about yourself, but think about those who are more vulnerable in the community that we all need to work together to protect. Thank you.
Dr. Wilson, if you want to stay up there, I'll open the line up for questions for Dr. Wilson. So if anybody has a question, you can ask it now.
Hi, this is Sheila from Summit Media. How are you? Sheila Smoot?
Hi, Ms. Smoot.
Hi. When you were saying about face coverings and how important that was, the mayor of Birmingham just relaxed that being mandatory Did you all talk about that? And if so, what was that conversation? Because it appears that at least in Birmingham, that people are just discarding facial coverings.
No, I have not talked to the mayor recently. My last understanding was that they had extended their order until July 3rd. I'd not heard anything beyond that.
What about the Black community? Where are these numbers coming from in Jefferson County? Is that whole conversation with Councilor Parker, which was pressing you on making sure we get zip codes? How is that going?
Yeah, so we have released the zip code data. That's on our website. And we're doing a lot of testing among the African American community. I'm very pleased with all the great partners that we have, including UAB, but including our federally qualified health centers and many others in the community that are helping us do community testing, that are making sure that we cover the map, including our underserved areas. And we are seeing, again, on our website, you can see the racial breakdown of cases of those tested and the deaths. It does look like we have a predominance of positive cases among African Americans, but fortunately, so far, we've not seen an increase in the number of deaths. We're at 44% of the African American population, or I should say 44% of the deaths are among the African American population, and that's compared to 42% of the population that's African American. So it's tracking pretty close to the population. So we'll just have to wait to see how that plays over time. We need to all remain vigilant, and especially those that are in the at-risk categories, to prevent that from getting worse.
Thanks, Sheila. Does anybody else have a question for Dr. Wilson? Okay, then we're going to welcome Dr. Nafziger back up to the podium, and if anybody has a question for her when she gets settled, feel free to either raise your hand or begin speaking. So give us one moment. Okay, if anybody has a question for Dr. Nafziger, you may start now. Is there anybody on the line that has a question? We'll take one from Facebook. Currently, can you comment on how UAB is with their PPE supplies?
Sure. So that's a great question. There's been a lot of conversation about PPE, or personal protective equipment. This has been something that's been one of our biggest challenges throughout managing this COVID crisis, and it continues to be one of our biggest challenges. We want to make sure that we have enough personal protective equipment to keep our staff safe. So we're still implementing all of our conservation measures at UAB. We're looking at alternate resourcing. We're reprocessing N95 respirators. So we're doing all the things that we can do to make sure that we have enough PPE. We do anticipate that this is going to continue to be a challenge for the foreseeable future, and that's just another reason that we're really pushing to stop the spread of this virus.
Does anybody on the line have a question for Dr. Nafziger?
Hi, this is Anna Claire Rollers with AL.com, and I apologize if I'll address this and I didn't hear. Do you have a number of folks on the ventilator right now at UAB?
I don't have an exact number in front of me right this moment, but I can tell you that throughout this crisis, approximately half of the COVID-19 patients that we have in-house have been on ventilators. So it's sometimes a little more than half, sometimes a little bit less than half.
Thanks, Anna Claire. Does anybody else have another question for Dr. Nafziger? All right, we're going to take one more question from Facebook. Somebody was saying, just in speaking with their family and friends who don't think that this is real and they're not really seeing the impact in their community, what do you say to those people as a professional, and what do you say in your social circles and people in your peer community?
Thanks. That's a really great question. I'm glad you asked, because I've had a lot of my peers and friends and family and people that I know ask me this very same question and say, hey, I really feel like this is much ado about nothing. This is just another type of flu. But I can assure you that I wouldn't be standing here talking to you right now if this were just another type of flu. If this were not a big deal, we wouldn't be restricting visitors to the hospital. We wouldn't have curtailed services in the past. It is a very big deal, and it's something that we need to take very seriously. Now, fortunately for most people who are infected with COVID-19, they're going to feel bad for a little while, and they're going to go on. Life's going to be great. But the really big deal is if we have a lot of people who are critically ill all at the same time. If we do have that circumstance, it will overwhelm our healthcare system, much like the situation that they saw in New York City recently. And that's the thing that we're going to try to avoid. We're going to do everything we can to avoid that here in Alabama. Are we there yet? Nope, absolutely not. We've all done a really good job at doing the things that the experts have asked us to do, and I really appreciate the public for doing that. But by all means, this is not a hoax. It's not much ado about nothing. It's a very serious situation and will continue to be. I think we're going to be fine. I think we're going to pull through this together. We're all in it together, our communities together, our states together, and I think we're going to be just fine. But we're going to have to continue to do the things that are a little bit uncomfortable.
Great, thank you for that advice. I think that we're going to welcome Dr. Marrazzo up if there's no more questions for Dr. Nafziger. Again, be patient while we transition. Okay. Does anybody on the line have questions for Dr. Marrazzo?
Yeah, I do. This is Sheila Smoot again. My last question is this, Dr. Marrazzo, thank you. The infectious part, how quickly can this spread? And I say that because it appears that everybody has put their guard down. There are so many weddings and funerals and going to the beach, and now we got family reunion season coming up, and now school is coming up. Can you talk to me about how important is it to still do the social distancing, and what are your thoughts on schools reopening?
Well, yeah, thanks for your question, Sheila. I think that obviously if we believe that this current increase that we're seeing is related to the relaxation of the social and physical distancing measures that people were so good about in March, April, and through much of May, then that really tells you that it is a very powerful tool to flatten the curve. We don't even hear flatten the curve very much anymore because the curve just seems to go on and on. But it really did work, and it worked incredibly well. In New York City, for example, they have done great. They're now talking about gradual reopening. So I think the challenge here is that when people hear reopening or that we're over the scary part, there's a very understandable tendency, as Dr. Nafziger has just said, to sort of get over the weary part and get over the painful part and say, wow, we can go back to normal now. We really have to embrace a new normal. I really can't emphasize that enough. And the new normal involves, as Dr. Wilson said, assuming that anybody you come in contact with could be a potential source of infection for you, whether they have symptoms or not. So, yes, in answer to your question, I do think we need to revisit those measures. The school question is much more complicated, and that would probably take a whole other conversation, and people are very, very vigorously involved in discussions about how to do this. With the school question, you have on the one hand the fact that kids have had their lives so disrupted by the events of the last 6 months, immeasurable stressors for parents, for kids, for teachers, for everybody, and not just being home and being socially isolated, but just not even getting the kind of in-person socialization and education that kids need at school. So the concept of stopping that in the fall is really, really serious and really scary to a lot of people. You're also talking about the workforce, right? Because if parents can't send kids back to school or care providers can't send kids back to school, that's really going to impact the ability for everybody to get back on their feet and get to work, whether they're working at home or whether they have to go in. The third part is that, the question is how quickly do kids get it? Do they get sick? Are they big sources of transmission? Those things we don't really know very much about. We do have a sense that kids seem to be somewhat less likely to get sick, for sure, because if you look at all the natural history studies we've seen, it's not to say it can't happen. We had an infant who died here in this state not very long ago. So again, they can happen, things can happen, but kids in general do not seem to be as vulnerable to the really bad effects of this virus as older people are. So schools just really have to weigh all those things very carefully and think about, if they are going to go back, how are they going to ensure that they're going to do the best they can to protect the people who come back to school and the staff who work there. And people are actively discussing those things.
Good question and answer. Is there anybody else on the line that has a question for Dr. Marrazzo before we go to Facebook?
Hey, this is Anna Claire.
Yep.
Oh,
Go ahead.
let's go with Anna Claire first, and then I don't know who the man was speaking. We'll go to you right after.
Okay, thanks. Dr. Marrazzo, you've said that you believe that the rise in positive cases has been attributable to kind of the state reopening. Are there any specific aspects of that? I mean, do you think that participation in, protests recently or, vacations on Memorial Day or something like that also contribute, or how would you characterize that?
Yeah, it's a great question. Every event is different. So if you are at a protest in a large outdoor park and 95% of people are wearing masks, as they were at Ingram Park a couple of weeks ago, odds are pretty good you're not going to get infected in a place like that. If you are at the beach and you aren't really on top of the people next to you, I mean, you have some decent distance, but then you go to a bar afterwards to have several beers with your friends, you're sharing a space, you're sharing utensils, you're sharing food, then you're very likely at risk for getting infected. So I think when people think about engaging in these kinds of activities, they have to remember that there are ways to make every kind of interactive activity safer. So it's not a go, no go. It's that light switch, dimmer switch thing that we talked about before. Sure, go to the beach. Who doesn't want to? I would love to go to the beach right now. I'm sure Dr. Nafziger and Dr. Wilson would love to go to the beach right now. But, go to the beach, but be thoughtful about the context in which you do it. So I don't think it's as simple as saying the protests are to blame. It really is, I think, as simple as saying people are mixing more, people are letting their guard down, people aren't wearing masks, and they're mingling and creating more opportunity. Remember, the metric that we tend to use is 15 minutes within 6 feet of someone. So if you are within 6 feet of someone for more than 15 minutes, that's when that alarm bell should be going off. It's not to say if you're right next to somebody and they cough in your face and run away that you can't get infected. Of course you can. But generally speaking, if you think about being in spaces and around people, that's a good kind of thing to hang your hat on.
Thanks for that. And I cut off a man who wanted to ask a question, if you want to ask that now.
Yes, this is Henry Thornton with Yellowhammer News. My question was fairly similar to Anna Claire's. I apologize if this would be making you repeat anything, Dr. Marrazzo. But it was basically just for anyone in the next month who plans to attend any further demonstrations in favor of police reform, or, say, President Trump's outdoor rally in Mobile that seems to be happening next month. Just advice you had for them, if there were some people who probably shouldn't go, sort of what you were briefly touching on at the end of your answer to the last question.
Yeah, that's a great point about people who shouldn't go. So there are people who should think not just twice, but many times before going out. I've mentioned my 93-year-old mother before in these media events, and she persists in going shopping. I do not think she should be going out. I think anybody really above, I mean, it's hard to put a precise cutoff on the age, but, above 75, I mean, if you're super healthy and you're 75 and you run every day, that's a different story. But really, age is a very big risk factor for this disease. If you are taking any medications that suppress your immune system, like steroids, If you have anything that might make you more likely to have complications of the disease, like lung disease, bad heart disease, uncontrolled hypertension, or diabetes, those are all things that we know really will make it much harder for you to recover from COVID-19. So please think twice. If you live with somebody who has those things, that's the other thing that's really important. Remember, it's not just you we're talking about. It's you as you affect and interact with every other member of your community and your family and your workplace. So I would think twice about those kinds of events. If you're going to go, remember it's probably going to be really hot, and if you're going to be wearing a mask, you're going to be tempted to take it off. So try to find a mask that you can at least try to keep on. I think that would be the best thing that you can do. Make sure you're well hydrated, and have some hand sanitizer with you if you can.
Thanks for that question. Is there anybody else on the line that has a question for Dr. Marrazzo?
Yes, this is Christy Raynard from WHNT in Huntsville.
Great.
I have a question. I read several articles over the weekend about a study saying that masks not only could flatten the curve, but actually, we've been preaching that wearing a mask protects those around us, but that it could actually protect us as well from COVID. But the fatigue that people seem, if you go to the grocery store, I went to the grocery store last night and saw several people, I would say half the people in the store, not working, but shoppers, without face masks. And how can we explain the people not wearing masks? I don't know how to explain it in a better way, but how can we the almost the mentality of it's not that important to wear a mask. It's only important for people who might be more at risk.
Right. Well, I think we all have a little bit of our own personal invincibility fantasy, right? That's not going to happen to me. I'm not going to get in a car crash. I'm not going to get cancer. I can smoke because I'm not going to, have lung cancer. So, I think it's a human trait. So I don't want to shame people for doing this. I don't think that's the way to do it. I think that a lot of people don't know anybody with COVID. A lot of people have never been in an intensive care unit. A lot of people have never seen a patient on a ventilator or been on a ventilator. I guarantee you, as Dr. Nafziger said, if you took care of patients on ventilators or spent some time in the ICU taking care of COVID patients, I think you would wear a mask because it's really heartbreaking, especially when patients are dying alone. Remember, they are isolated. We don't want staff and other people mixing with them. We don't want their vulnerable family members going with them. Surely you've seen the videos of patients saying goodbye to family members on Facebook. If that doesn't really break your heart and get you to start thinking about what you can do to stop this, then you really are made of stone. So I think that I don't think people are being willfully clueless or mean. I think they're just not thinking, and they're just going about their business, and they don't have the personal, real lived experience of having done this. That said, it's really why we do these, discussions, and why we rely on you all in the media to continue to keep this in front of people and really translate our pleas to wear a mask to those folks. One other point I want to mention. Dr. Nafziger mentioned that we are in a good place in terms of being able to take care of patients, and I agree, and we are going to get through this. But remember, at the height of the COVID epidemic, in many places, care for a lot of other routine things just stopped. Heart attacks were happening, but people weren't getting care. Strokes were happening, people weren't getting care. That's the other thing. We really don't want to get to a place where we're so consumed with taking care of COVID patients, rightfully, and they need it, that we are neglecting or unable to meet the needs of our many patients who really, really need, just good care for their everyday non-pandemic illnesses.
Thanks for that. Is there anybody else on the line that has a question for Dr. Marrazzo?
Hey,
Hey, this is Anna Claire again. I'm sorry, one more. I was wondering if you could say whether the rise in positive cases is attributable mainly to community spread around the state, or is it because of like outbreaks in like a nursing home or workplace or something?
Yeah.
And also whether or not you've seen any hotspots aside from Montgomery that are concerning to you.
Yeah, that's a good question. You know, I think with this number of infections, and Dr. Wilson is really eminently qualified to comment on this from his public health perspective, but in my opinion, I think that we now have just widespread sustained community spread. There's so much infection out there. You could go anywhere and potentially be exposed, right? I mean, Dr. Wilson mentioned that the positive rate here is 8%. That's almost 1 in 10 people. It's a lot of people who are being tested. I mentioned it's at 13% in the state. So I think it's really just out there in a way that makes it very easy to get it in the community. And that's when we talk about things becoming pretty much endemic in the community. I do think that there are still probably potential outbreak situations. We just don't know exactly where they're occurring yet and where the hotspots are. We continue to see infections in nursing homes, although that's been a very big focus of the public health workforce, and a lot of people are working very hard to try to tamp that down and minimize the number of infections we're seeing there. So I think it's probably pretty much all over the community.
Okay, any final questions for Dr. Marrazzo before we take a few from Facebook? Anybody on the line? Okay, just a few, Dr. Marrazzo. One person has asked, were we seeing any success with the hydroxychloroquine before it was stopped by the FDA? Can you just elaborate on that?
So we were and remain part of a study, a clinical trial, to try to answer that question. One of the challenges with using medications outside of the context of research is that you really don't know if the person you gave it to would have gotten better if they got the drug or they didn't get the drug, unless you have a really well-done study where you can compare it to them not getting the drug. And usually that's done with a placebo, right? A sugar pill kind of thing. We are doing that study. I encourage people to call us if you're interested. We'll post the research number we have. We're looking at hydroxychloroquine and azithromycin as a treatment for outpatient COVID, so not the kinds of people who are coming into our hospital. I fully believe that we do need to look at it because we really don't have very many options at all right now, right? So we need to know if that works. So I can't really say on the basis of our experience whether it's done anything. If you look at the literature that has come out in the last 3 weeks, it's been, I would say, uniformly enthusiastic and unsupportive of using it. And again, I'm certain that's why the FDA revoked the emergency use authorization today.
Another question, I feel like we may have addressed this in the past, and we may not know. If you tested positive for COVID, can you get it again?
It's a great question. It's also $1 million question. If you test positive for COVID, we assume, based on how we understand other coronaviruses that cause respiratory infections, that you generate antibody and you are immune to getting infected with it again for a certain period of time. We don't know what that period of time is. We don't know if some people are less immune than others, perhaps people who don't have as robust an immune system. In regular coronaviruses, that period of protection is about maybe 8 months to a year, which is why you get colds every winter, because you tend to get resusceptible to them. So that's what we're thinking, but we really don't know. It's a really important question because we are about to start very large vaccine trials with some promising candidates for COVID-19, and we will be measuring people's immune response when they participate in those trials. So we should have some good information on that in the next several months.
Okay, and one more chance. Anybody on the line have a question? If not, we'll let Dr. Marrazzo come off and we'll conclude. Okay.
Thanks.
Thank you for joining us today. Just as a reminder, you can continue to track your symptoms at helpbeatcovid19.org. As we feel necessary, we'll continue to do these news briefings. If you have any follow-up questions, please be sure to reach out to me or anybody from our team, and we will work to get those answered for you. Thank you.